Good evening, everyone. This is the May 10th meeting of the West Boylston Board of Health. So we've all looked at the minutes for 3:15 and 4:19 and signed them. I'd like a motion to approve
I make a motion.
as signed.
There's just one minor correction. That's the building is owned by the Municipal Light Company and managed by John Fitch.
Is that, you're making a motion to
I guess,
modify?
can you just change it? I mean, it's a
Oh,
real,
okay.
it's just a real minor point.
Got it. All in favor of the motion to approve as amended?
Aye.
All right. COVID-19 updates. So as I mentioned in the last meeting, we are at the lowest levels that we have been in terms of number of cases in the community. The UMass system has stopped reporting weekly reports of the numbers of patients who are COVID positive in the hospital because they've dropped to levels that were just above baseline. And our wastewater levels from Blackstone are as low as they've been in years. So, but I did want to hand out this new, we can pass these along. There's copies.
You have one for Jessica as well.
Yeah, we got Jazz,
Thank you.
Solo. So we have been getting reports for the last couple of years from BioBot, which is a company that was formed by scientists from MIT. Just in the last few weeks, we started getting reports from Wastewater Scan dashboard. And this wastewater scan is an organization that was formed by collaboration between Stanford and Emory scientists and now has the backings of a number of philanthropists. And they are doing this kind of as an experiment. And so what you can see is, I've given you there, I think, 6 or so different scans. The first one is SARS-CoV-2, and you can kind of see what's happened in the last few weeks, and you can see what's happened in March. And so we're way down to levels that we haven't been at in well over a year. The next one, the beauty of this is that they're actually looking at a number of different pathogens. So the next one is influenza. And as you can see, there's no influenza activity. But if you go back and look in March, you can see that there was flu in our community. The next one is respiratory syncytial virus. Again, in the last week or two, no activity. But if you go back to March, you can see the levels of activity that were present in the community. Next, we have the human metapneumovirus. And some of you are probably not familiar with that, but this is a virus that was first discovered in 2001 in the Netherlands. It's been around for about 60 years, but nobody had actually identified it. It's in the same family as respiratory syncytial virus, and it's a really common respiratory virus. And a few months ago, we had tons of kids in the community with metapneumovirus infection. They were actually overwhelming the emergency room. This is an infection that affects most kids by 5 years of age. Again, you can see that this virus is still present in our community, but at increasingly lower levels. Next, we have the monkeypox. As you're all aware, we had an outbreak of monkeypox last year. Actually, it was a global outbreak. WHO now calls monkeypox Mpox because they don't like naming viruses after towns or animals. And in fact, the animal that probably, where this is endemic, is rodents in Central and Western Africa. And there was an outbreak of Mpox in the United States in 2003 that was by prairie dogs. And the prairie dogs were bought as pets from a distributor, and the distributor had housed the prairie dogs with some rodents that had been obtained from Africa. So the African rodents infect the prairie dogs, people took the prairie dogs home and got infected with them. But again, here, we've had no monkeypox in our community at all, basically. And then lastly, we have norovirus. Norovirus is probably the commonest cause of epidemic gastroenteritis. And it's easily spread by any fecal-oral contact. A lot of times, people are working in the food industry, they contaminate food, and people get this. I think Chipotle had a major problem with this. This was actually discovered in 1971 by the former chief of infectious disease and Department of Medicine chair, Neil Blacklow at UMass, when he was working at NIH at the NIAID. And it actually came from specimens that they had obtained samples, fecal samples from individuals who had this epidemic gastroenteritis in Norwalk, Ohio in 1968. So they were 3 years old. They went to the freezer, got them out, put them through a filter, and took the filtrate and got volunteers, like the rest of us, to actually take this. And when they ate it, they obviously got gastroenteritis, and that's how they nailed it as a cause. And it's now called, it's noro. They didn't want to continue the name Norwalk, so it's norovirus. But again, you can see this is a virus that's very present in the community. The point I'm trying to make here is this wastewater scan is actually a fantastic tool for really looking at potential, major pathogens that would affect the community. And right now, this is an experimental. And I took the liberty of sending a note to Robbie Goldberg, who's our new commissioner of public health for Massachusetts, and said, this is the kind of thing that the state needs to fund on an ongoing basis, because this is a huge, important public health tool. Because if you can see that all of a sudden a new agent is present in the community, and, for example, when we first got wind of this virus in China and then spreading, you immediately can put the sequences, be able to look at this and immediately know whether your community's got this or not. So hopefully this will be something that we'll be looking at for a long time. So that's my teaching session.
Thank you for your advocacy.
That's great.
Our next agenda item, our Central Mass Regional Health Alliance update. Solo?
Thank you. Good evening. Thank you, Mr. Chair. 2 weeks ago, we had our first alliance meeting with all three alliance communities. It was a very productive meeting. At that meeting, we discussed the new IMAs that will be coming up pretty soon. We also discussed the governance structure, and we discussed the funding mechanism of the alliance moving forward.
And what is the funding method going forward?
Well, it's the, so, the town has agreed on funding number that we have discussed with the town administrator. And the next step is putting that funding into the next IMAs. The IMAs consist of the scope of services that we'll be providing to the town of West Boylston around emergency preparedness, around data, around nursing, around the community health work, and also around the environmental health work.
To the chair, I guess I should go, but are there gonna be sources from the community for the alliance, other than sources from the communities? Is the state pitching into the alliance?
Yes, so there is funding that will be available to the alliance community that the alliance community can leverage in terms of training, in terms of professional development. So that work is is being done currently. Once the agreement is finalized, I will definitely provide an update to this board.
So has our community finalized the IMA with the Alliance at this point?
It's in
Is
the
a
draft
select
format.
board?
It's in the draft format, so all the IMA gotta go through our legal services and your legal services as well, so everyone have to review them.
But I believe in general that, I mean, certainly this board approved when our town administrator came. And I assume that the select board has approved going forward with the
Yes.
IMA, yeah, as,
Well, they have.
based
not-
on the amount, you know,
Yes.
that was,
Yes.
right,
So, but everything will need to be reviewed, everything need to be looked at, so.
right.
Okay.
Any questions?
Micah, did you have?
Sure, I don't have anything out of the ordinary to report. We did one housing complaint that has been resolved. Other than that, it's been just the routine food inspections. Have been fairly routine. There's been no recent foodborne illness complaints or anything else that's ringing any alarm bells for me, so I've just been chugging through the inspections.
Nobody's spreading norovirus in our community.
No, I haven't heard of anything, and, yeah, just always remind people that it's out there. If you don't wash your hands, it can become a bad scenario.
Could I ask a question?
Sure.
The state sanitary code has been rewritten, and has that formally been adopted with the changes yet, or where do we stand with that?
The housing code, or,
Yes.
I actually don't know where we're at as far as adopting the new changes, but they're,
So I think they're still in, so what they did was, they had a listening session, but the whole process hasn't been fully adopted yet, so hopefully soon it will be adopted.
It looked like there were substantial changes.
Yes,
it was supposed to go into place in April, but then it's been delayed.
yep.
Right, I thought it was gonna be adopted this week, but I didn't hear, so, okay.
Other questions, comments? Okay, public health emergency preparedness updates. A trailer
Right,
story.
I don't have anything on the trailer, but the next meeting of FEPIC is what, a week from Thursday, out in Charlton?
Yes,
I think it's at 9 AM, I hope.
yes, I believe it's 9 AM.
Yeah.
In terms of the public health trailer, we have identified a consultant that will be coming up. That consultant will be in contact with Jessica pretty soon.
Yes, I have a name.
Yes,
I heard from Melissa earlier. It looks like we're gonna be working with a woman named Kayla, and we're gonna be using the Comms Mobile Solutions as the vendor. She did email me earlier, today, and we are ready to move forward. So once we get Kayla and her team scheduled out, they'll be able to come get the trailer and perform the maintenance that is
So the
necessary.
discussion we had
The
today is
discussion we
resolved.
had-
Yes.
Yes, correct,
Okay.
yeah.
Yes.
It's good news.
yes.
Great.
So, may I ask, what has been outlined for trailer repairs? Do you, how is that contract set up? Do you know?
So in terms of the maintenance of the trailer,
Yeah,
so I believe the process will be, the consultant will go through the trailer, consultant will look at the exterior of the trailer, will fix the tires, repair any tools, any equipment that need to be repaired. I believe also they will try to replenish the supplies in the trailer.
will they
And
go and inventory the stuff in the trailer?
I believe so, but I can double check with my
Yeah,
colleague tomorrow.
because like we said last time, some of the stuff might be out of date.
Yeah, so, but I can double check with Lisa and I can email, Miss Jessica tomorrow about it.
Yeah, good, yeah, okay, very good.
Okay, Board of Health budget.
Okay, so, the fiscal year 2024 Board of Health budget will not have the $9,000 tax levy as seen in previous years. For the new administrative assistant salary, that will be paid through the building department. as both the building department and the Board of Health, beginning fiscal year 2024, will combine under the inspections. The new title of the Board of Health Administrative Assistant will be the Department Assistant Inspections. And the Board of Health's current revolving fund sits at $91,321.22. And the three reports are there for you to look over. Any questions?
Yeah, through the chair again, I did have a conversation with the town administrator on this, because, of course, I had heard that we were gonna get the Board of Health had no tax levy, and I was very concerned, and so she basically explained to me just what Jessica has explained, that the funding is gonna come through the building department, and so if you see a zero for the Board of Health in the budget,
Yeah,
don't panic, yeah, okay. Because I panicked.
The office report?
office report?
Sure, I just have a few things here. As far as permits and fees go, we had 137 approved for the year 2023 so far, with 2 still pending. Michael will be following up on Camp Woodhaven, it's still being reviewed, and Sterling Meadows pool application is in, but it's not complete. I believe that's in process of resolution. For Title V project updates, we have a big update on 104 Shrine Ave. Wednesday, May 3rd, NHB Construction applied for a septic abandonment permit. The fee was paid by check and Phil Legier notified. And NHB Construction stated that they will reach out 48 hours prior to the pumping and abandonment process to Phil. Let's see, so 114 Lee Street, we did receive the DSCP fees that was able to process. And Phil Legier did complete the septic quote as of this afternoon. All is well there, he signed off on it, and the home is hoping to close, the sale of the home is hoping to close this month for 114 Lee Street. I just have the 3 other Title V projects. 385 Lancaster Street, building permit has been issued, no progress. 13 Winthrop Street, still is scheduled to be completed in the spring 2023, and 33 Prescott Street. They have named, Baldarelli and Sons contractor has been named by the owner, and they still have to renew their permit for 2023 as well. Tobacco violations and issues, the regulations have been received for the environmental smoke tobacco via draft form, and through you, Mr. Chair, if we could put that revision of the tobacco regulations for environmental smoke on the next month's agenda.
Good. Other questions or comments for Jessica? Any new business? Hearing none? Motion to adjourn?
Wait a minute, we have to set our next proposed meeting date, I'm sorry.
Oh. So the second would be the 14th?
Yes,
So maybe you could send out an email, Jess,
Sure.
on June 14th as our first choice. And if we have issues with that, we can go elsewhere with other dates.
Okay.
motion to adjourn?
Seconded.
All in favor?
Aye.
Aye.